Welcome back. COVID tests will now set you back 500 Rand. That's 350 Rand less than the 850 Rand you used to pay. The decision comes after the Council for Medical Schemes laid a complaint with the Competition Commission in October. Let's speak now to John Letsoalo from the Council about their thoughts on the news. Thank you so much, John, for your time. Let's just speak about the fact that you went to the Competition Commission to lay a complaint about how exorbitant the cost is around COVID-19 tests. I'm sure you welcome the move that the price is now reduced to 500 Rand.
Yeah, not true. We truly welcome the move, and I think, most of the South African population are going to be, happy that, look, the prices have drastically reduced from 850 to 500. So as the Council for Medical Schemes, we're quite delighted and happy that the prices have quite, gone down. So, yeah, we are happy.
Do you think 500 Rand is a good price to pay for a COVID-19 test?
Yeah, no, thank you. I think it remains to be seen whether, 500 is a good price. I think there's going to be a lot of engagement in terms of pricing and the costing, and the input cost in relation to the PCR test. So I think as a Council for Medical Schemes, we'll be engaging relevant stakeholders, the private laboratories, partnering the ministry, and the funders from our side to determine whether, the 500, is, a justifiable amount to be paid. So I don't think this is the end of the road in terms of what the Council for Medical Schemes intended to achieve. I think there's a lot of engagement that we'll still pursue in relation to the price, whether it's going to be, dropped down below 500 in terms of the consent order from the Competition Commission. I think that seems that still is going to be determined, and we'll see whether in those engagement are we going to find each other or not.
Do you think that it's a little too late, though? Because many would argue that it's almost 2 years into this pandemic, and initially people were paying over 1,000 Rand for a COVID PCR test. It then dropped down to 850 Rand, and we've been paying that for roughly 20 months. I understand that the Council for Medical Schemes actually laid this complaint with the Competition Commission. Do you not think this should have been done sooner? Because we do know that people are struggling, and 850 Rand for every COVID test seems quite exorbitant.
Yes, I think from where we sit, I think this issue should have been resolved, a little bit earlier, but I think we find ourselves in very extraordinary circumstances, and I think we would accept, and most of us, we will accept that, COVID-19 has found us, in very difficult circumstances. So I think you need to go back in terms of the background and understand what precipitated, the actual, agreements that the private laboratories had with government and the health funders. You'll also appreciate that, the realm in terms of the mechanisms of what should have been, the prices and how they should have been, agreed, and the costing model pertaining to those prices. I think that, felt within the blocks exemptions which were, given by the Minister of Trade and Industry. And I think, by hindsight, I think all of us, we could have done a lot in terms of ensuring that the nuts and bolts pertaining to those exemptions were clear, so that when the prices were fixed, or rather were agreed in terms of the Competitions Act, and those exemptions were justifiable and fair for everyone. So, yes, I could agree with you that, we come into this pot, quite late, but I think we come at a time when, the fourth wave is looming, and that, we as the Council for Medical Schemes, we feel that we've did our best to ensure that, the population at large, pay a price, which in our view has always been justifiable. And we continue to believe that only the population of South Africa and anywhere around the world must pay prices which are fair. If you look at the costing, the input that goes into the PCR test and everything. So we feel that this is a fight which, goes into the heart and the mandate of the Council for Medical Schemes, which is to also ensure that the public, especially from a private healthcare perspective, in fact, even from a public healthcare perspective, they pay prices which are fair and which are reasonable and which could be justified, from a costing perspective. So our view is, look, it comes at a point where it's quite late, but we felt that it's something that should have been done by a regulator like ourselves, which regulates the private healthcare industry.
Do you think that it's satisfactory that these laboratories will not be fined? The Competition Commission says because it's an agreement that has been reached with all parties and stakeholders, they will not be fined. And the reason why I ask this is because billions of rands have been made in profits. And you just alluded to the fact that something should have possibly been done earlier. 20 months in, we were paying 850 rand for these tests. Billions of rands have been made in profits, and these labs are not going to be fined. Are you happy with that?
No, thanks. I think, look, the issues pertain to, the competition law context. So whether or not the fines are going to be justifiable or are going to be there, I think that's another issue. I think what the public at large should appreciate is this issue emanates from, the consent orders, which comes from the Competition Act, which, the Competition Commission has took up with the, with the private laboratories. So in as much as there could be profit margins which have been made, I think that's another issue which, could be discussed from a competition perspective, especially from, the competition jurisprudence point of view. So our view at the moment is, as Council for Medical Schemes, we believe that we've done the utmost best that we could have done for the population of South Africa to reduce the pricing of the PCR test to the price that it is now. Whether or not, there's going to be any recourse or any remedial action by the Competition Commission. Whether they can do it, I don't know. What we know is those, agreements follow from consent agreement where, parties have agreed to reduce the price. So we'll be guided by the Competition Commission in terms of their own legislation and their own regulation, whether that is possible. From where we sit at the CMS, we feel that the reduction of the price, it's a way forward. It says to the public at large that the Council for Medical Schemes is working towards, putting measures to protect the public, and that we are always mindful of the health benefits that our public is receiving. And we're going to be mindful of the fact that the custodian of those blocks exemptions is the Competition Commission. And those questions that you've raised are going to relate to them and see how best those fines in relation to the profitability issues could be dealt with in terms of their framework, because the complaint does not lay within the Medical Schemes Act, but rather lay within the Competitions Act. But we are going to make sure that we engage them and see, how such conduct is going to be dealt with within the legal frameworks of South Africa.
John, I just want to go into the fact that Pathcare did not agree to the reduction of the price of this COVID test. I just want to get a sense of whether or not you were involved in these conversations about reducing the price of these COVID tests. Were these labs willing to do so? And what is your sense and response to the fact that you do have a lab that's not willing to reduce the price?
Yes. Look, I think what, the public needs to understand is the issue pertaining to whether, the respondent on a competition issue, they agree or they don't agree. I think that falls within the competition law framework, and that falls within the jurisdiction of the Competition Commission. So if we lay a complaint, in terms of the Competition Act framework, we are guided by the Competition Commission. Whether, the public perceives us as a regulator for the private healthcare, I think the public needs to understand that, the preamble and the custodian of those blocks exemptions in terms of the restrictive practices, either horizontally or vertically in terms of of those block exemptions falls within the Competitions Commission. So, whether any party within, those investigations on our complaint agrees, cooperates, or refuses to cooperate, I think those are the issues that we can take directly to the Competition Commission. And I think they will be able, to explore and to be able to say to us, look, these were the attitude and these were the legal, parameters that we're faced with in terms of ensuring that all the parties beyond who we know that have agreed to the consent agreements, came to the party. And if they did not do so, what were the basis of such refusal? I mean, we may be, persuaded that, look, those were blatant refusal, but, they may be couched in other legal matrices in terms of the Competitions Act. At the moment, I wouldn't, want to venture into that space because the competition law, representatives will be clear to explain to us why certain, parties came to the party and other ones didn't vote.
John, just lastly, could you quickly tell us whether or not the Council for Medical Schemes will be laying further complaints around COVID-19 and the testing? Yeah, look, as the Council for Medical Schemes, I think we're quite aware of, the issues that prevails in terms of private healthcare. So we are not going to say, to the public will be, laying any complaint. I think our basis is that we have, a robust research data, department which looks at, the COVID-19 related issues, the frameworks and any anti-staph issues that, somehow, goes against the heart of what members of medical schemes and the public at large should be receiving. So at this point, unfortunately, we wouldn't be saying would be lodging other complaints. I think it's safe to suffice that definitely the CMS is quite aware. We are quite, inquisitive in terms of, the COVID-19, how it works, especially the fourth wave moving, and that will be ensuring that if any issues that are prejudicial to the members of medical schemes or the public at large, if they do happen, definitely we as the CMS, we are going to take action. We are going to ensure that the relevant regulators are involved to ensure that the population of South Africa survives this pandemic in a way that does not, negate their own Bill of Rights and other, rights that they may enjoy in respect of relevant legislation. Great. Thank you so much for your insights. That's John Letsoalo from the Council for Medical Schemes weighing in on the announcement that the cost of COVID-19 tests has now been reduced to 500 Rand. It's also important to highlight once again that we have asked AMPATH and Lancet to be present tonight to explain the costing around COVID-19 tests. And we were told that they were not available. Instead, they sent a statement out to say that they welcome the move to reduce the price of COVID-19.